do an operation using this instrumentation. So he recalled a colleague that he had known years ago in Paris, a Dr. Jean Dubasset, and he went and he showed him the instrumentation. And Dr. Dubasset was immediately impressed with the whole thing and thought it had tremendous potential. So at that point, they set up a first operation very quickly. That was in about December 1982. And then January 1983, they did the first operation using this instrumentation system. And an additional benefit, it gave three-dimensional correction, and I'll explain in a moment how that works. But it also provided such a stable condition for setup for the spine that the patient walks out of the hospital, no external support, no brace, no cast, or anything. And so at that point, it moved quickly. Over the next 22 months, they did 137 operations in Paris at St. Vincent de Paul Hospital in Paris. And then after that, it basically exploded worldwide. And so in one second here, I got to grab my book that has the picture to explain how it works. 1 second. Okay, so this is Atlas from, and this was actually my surgeon. This is from Minnesota Spine Center. And here is a picture of what's going on. So this is how it works. So basically you have these strategic clamps on each side of the curvature, and they would set up 4 on each side, and then you have the rods. They changed how the rods went. Instead of they put these what they call a diamond-studded surface on the rods, so it was like a rough surface that could really easily, the clamps could easily have a really strong grip on the rod. And then the rod is bent at an angle depending on the patient. And so what you do is you put this bent rod is assembled into the curvature like this. And then it's rotated 90 degrees. So what you end up doing is basically, in some ways you could say, turning the scoliosis curvature into the kyphotic curvature. So if you look at the model here, you would have lateral curvature, and then from the side it would be, say, abnormally flat. So you have the rod is bent at a similar angle as the curvature, and then it's rotated 90 degrees, which straightens out the lateral curvature. And then, from looking at it from the side, as you rotate the rod 90 degrees, it takes the flattened spine and puts in a normal degree of kyphotic curvature. And geometrically, by nature, by doing those two things, you also derotate the spine, so it corrects in all 3 dimensions. And the patient walks out of the hospital after about 5 to 7 days after the operation, no brace, no cast. And you could see, here's a perfect picture. So here's a patient, and you can see, so this degree of curvature is actually a more severe curvature than most of the surgeries, and yet you can see the result. It's almost unbelievable. So, like if you look at this patient, you can see, this is that patient, there's the x-rays. So you can see the correction here of the lateral curvature. And then here is the side view. And you can see the patient has 0 degrees of kyphotic curvature. And then after the operation, it's 21 degrees. And normal is like 25 to 35, so almost a normal degree of kyphotic curvature. And then you can also see, here's the rib cage, a cross-section MRI of the rib cage. And you can see it's dramatically derotated. And this picture there, I mean, that's worth 1,000 words. I mean, so anyways, in the last 25 years, at this point, there's been worldwide over 1 million people operated on with this instrumentation system. And pretty much all the state-of-the-art instrumentations now use this technology. They're called one of 3 things. It's either Cotrel du Basset, which is the original, which was what I had in 1989. There's CD Horizon, which is Cotrel du Basset. That's where they basically, instead of using the clamps, they changed it to using pedicle screws, which would go into each one of the vertebrae. And then there's what they call Texas Scottish Rite instrumentation, which is very similar to the CD Horizon. But they all work off the original 1982 prototype that Dr. Cotrel designed. And so in over 30 years now, basically nothing other than some fine tunings, or there's really never been anything developed better than this for surgical treatment of scoliosis. And that's mostly the story in a nutshell. And then the final thing, the way the book leaves it, is that he set up a foundation, the Cotrel Institute Foundation, that the ultimate goal is to, it's called idiopathic scoliosis, meaning there's no known cause for the condition. So the idea that continued research, you just keep plugging forward so that there would be a day where, perhaps surgery could be done away with completely, as if you could understand what causes it. Because the surgery, as amazing as it is not a perfect solution, because you still have to fuse a significant portion of the spine, which you lose some flexibility. And so although it's an amazing accomplishment surgically, and it probably will be basically the best that can be done surgically, it's not the end of at all, because if it could ever be understood exactly more what causes the condition, there could be the possibility of treating it in an even better way, where you wouldn't have to do surgery at all. So anyways, that's the story, and thanks for watching, and I hope you enjoyed the story. Thanks a lot.